everybody. It's such a great group. I'm so happy to see all of you here. What brought you here? Was it the ads on TV?
Yeah.
The phone calls? It was Mary! Thanks, Mary. So you're here whether you like it or not now. So again, my name is Christie. I'm the Regional Director of the S.H.I.N.E program. And I just want to tell you the S.H.I.N.E program is it's operated under a federal grant. It's an unbiased way of getting information. We're not selling you anything. We're not selling you plans. We're not getting paid to steer you in any direction. We're really here to educate you about your options because Medicare can be very confusing, right? And so to make a good choice, you have to know really a lot about your options and what risks and benefits you're going to have if you go a certain direction. So a lot of mystery can be surrounding the Medicare Advantage program. So I said, let me come out and talk about that program. We spend a lot of time doing one-on-one appointments with people, and that's fantastic. But it's also good to do these bigger, sort of in general outreach, presentations. So this is going to be in general about Medicare Advantage, and then if you need to talk about whether you think this is right for you, you would schedule with your S.H.I.N.E counselor, Jill. She's going to get a lot of business usually after one of these. Yeah. And you can get a one-on-one visit with the S.H.I.N.E counselor to go over things because you go into a lot of personal information that obviously you wouldn't want to share in a group. So you can talk about your finances, your budget, your medications, your health conditions, your personal lifestyle, whether you travel with, there's so many factors that go into what insurance you might need. So that's where your one-on-one visit is really important. All right. So we're going to talk more in general today. I'm going to just do a quick overview of Medicare A and B because that's how we get to this Medicare Advantage. You have to sort of know what A and B do to know if you want to replace it with the Medicare Advantage plan, right? So when we talk about A and B, that's the pink at the top. Medicare A and B, which is what you get from the Social Security office. You go there to enroll in your A and B, or you go to their website. Now, Medicare A typically has no cost to you because you've paid into it with your taxes and your payroll. You can see it coming out every week if you take a look, if you're brave. So you paid in and now it's usually no cost to you. Part A is going to be when you go into the hospital, when you go into skilled nursing, or if you have to have hospice care. So big items under Part A. Hopefully you don't have to use Part A very often, right? But if you do, say you did wind up in the hospital, your deductible under Part A is $1,600 this year. Changes every year just a little bit, usually going up. All right, so if you went into the hospital and you spent a couple days in the hospital, you'd have a $1,600 deductible under Part A. And then let's say you get discharged, you go home, and 60 days goes by, and you go back in and you're admitted to the hospital, you'd have another $1,600 deductible, okay? Because that can happen more than once in a year. All right, so that's a lot of money to think about, right? The other thing is if you go into skilled nursing, that's covered under your Part A. You get about 20 days. After that, it's $200 a day, all right? So that's the big items under Part A. Any questions about A? No? All right. Part B is the part that you pay a premium for. So every year this premium changes. This year it's $164.90. Correct me if I'm wrong because the number just went real fast through my brain, but $164.90 I believe is the number. That's what you pay every month for Medicare Part B. That's the standard amount. Some folks pay a little bit more or a lot more depending on where their income falls on their tax return. So it is adjusted if you have a higher income. You pay more.
You have one more.
Oh, come on in. You're welcome. So Part B is the part you're probably going to use the most. Part B has all of your preventive services. So if you go for your mammogram, your colonoscopy, your flu shot, there's a whole long list of services under Part B that are considered preventive and they have no cost to you, okay? Other than that, you have everything under Part B. You have your doctor services, your testing, your labs, your x-rays, PT, if you have any equipment like a wheelchair, a CPAP, an insulin pump. A lot of things fall under the umbrella of Part B. There could also be treatments or medications that fall under B, like chemotherapy or dialysis, or if you have to go and have a medication injected or infused by the nurse or doctor, that's probably going to be under Part B. So under Part B, you have a yearly deductible of $226. And then after you pay that $226, you're going to pay 20% coinsurance. All right? So we call these out-of-pocket costs under A and B the gaps in A and B. So under A, anybody remember what the big one is under A? $1,600 if you go in the hospital. Anybody remember the deductible under Part B? $226. You're very good. And then what's your coinsurance after that? 20%. I heard another comment. 20%. All right. So those are the things that you're left with out of pocket. Now you could go down this route. We're not going to talk about this too much today because we're on Medicare Advantage today. But you could go under this route and you could add a supplement. Some of you might have heard and used Blue Cross Blue Shield MedX Bronze. That is thrown around a lot. There are other companies that offer supplements that you could also use. The supplements will cover it's like gap insurance. They cover those gaps. All right? Secondary to Medicare, second payer, and then you need a separate drug plan. So if you go this route, you have 3 different cards. You have your A and B, you have your supplement, and then you have your drug plan for the pharmacy. All right? Today we're going to talk about if you would like to go into Medicare Advantage, which would combine everything into one. And you can see up here, sometimes people call it a replacement plan. Medicare Advantage becomes your primary coverage. All right? There's a lot of things to consider. Under Medicare Advantage, because it's your primary, you have to go, everything you do has to go through that plan. And you do have a network of doctors. When you go with Medicare A and B as your primary, it's federal. You can go to any doctor that takes Medicare. If you go with Medicare Advantage, you now have plan networks, okay? Now, there are a whole bunch. I'm going to give you a list of all the different companies that offer Medicare Advantage plan. There's over 40 different Medicare Advantage plans offered, if you can believe it. So that's kind of tricky to narrow it down. So one way is looking at your network of doctors. There are a couple different types of Medicare Advantage plans. So it's basically like an HMO or a PPO style. An HMO means that you have a closed network. So you can only see doctors within that network. All right? A PPO gives you more flexibility so that you can see doctors outside of the network. However, you do typically pay more. So let's say you go to a specialist and you pay $40 in network. If you go to a specialist out of network, you might pay $60. Oh, got it? I don't know how to do it. That's okay. So you get more flexibility with a PPO, but you do pay for it. So do you want all of your doctors to be out of network? No, you don't want to be paying that higher rate every time you go to the doctor. So you do look at networks, and that can help narrow down out of the 40 different offerings, which ones do you want to focus on to look at? Because it's just too many to compare. A lot of details too. We're going to get into the details, and it's very taxing to examine all the details. If you were going to do over 40, there's no way. So we narrow it down to what does your doctor accept. The other way we can narrow it down is by your medications. So the drug portion of your coverage is built into Medicare Advantage plans. There are some offered that do not have drug coverage, but you cannot purchase that type of a Medicare Advantage, and then a separate drug plan. All right, so if you need drug coverage, it has to be built in. You can't get this standalone drug plan and a Medicare Advantage plan. You have to have it built in, all right? So that's another way we can narrow down what your options are, because we would put in your medications, your dosage, your pharmacy, and then we use a website that really helps a lot. It's medicare.gov. It's available to all of you. It's available to the public. You can go on and put in your medications, and it will sort out and tell you what plan will cover you and your medications for the lowest cost. All right? Anybody have questions so far?
Not yet.
Not yet? All right. You're gonna have some soon. Ready? All right, I'm going to pass out. I hope I have enough of these. Now, I told you I'm not selling any, oh, thank you. I'm not selling any particular plans. I'm starting off with AARP because it's easiest on the eyes. I'm gonna ease you into it. All right. Sorry. I did a switch up. All right, so let's go over. This is a lot. What we end up spending a lot of time if you come to a S.H.I.N.E counselor. Oh, and this one's a little different. Not that one. Oop, I think I hooked that. Would you mind passing them down? Thank you. You knew what I was going to say. There you go. Okay. You want one to follow?
Thanks very much. I think I know what I'm.
You know, okay.
You made it clear. Oh, hi.
Uh-oh. All right, so I'm going to squeeze by you. Sorry. Thank you. All right, so I'm not pushing AARP Medicare Advantage, but I think it's a good one to start out with because it's, like I said, it's in the big print, easy to follow in a group. But I want you to know how to look at these different costs that are built in. Because remember the A and B costs we talked about, they're gone, they're in the background now if you go into an Advantage plan. You still have to pay for Part B. So no matter what, which way you go on this chart, you do have to pay the $164.90 for your Part B. That still happens. All right? So let's say you decided to enroll in the first one. This is AARP Medicare Advantage Choice PPO. See how they're laid out in columns? Can anybody tell me what you pay for your premium? Can you find that line?
Nothing.
Nothing. Zero premium. Has anybody seen this on TV? Yeah. Zero premium is a pretty good premium. You don't get better than that. All right, let's just look at the different costs because everything's itemized in Medicare Advantage. So if you look at primary care provider visit, what's the cost there? Zero. That means you could have this plan, you could have the drug coverage built in, you can be covered, and when you go to the primary, you pay nothing to see your primary. What about if you see your specialist? 45. That's pretty average amount. That's pretty common. And you can see it's across most of these plans. Now, see the one on the end is $47? If you pay $47 a month, they give you a little break on the specialist visit, right? 40 instead of 45. See how that goes? All right, let's see. Preventive services. What did I tell you about preventive services? Do you remember if there's a cost to you?
No.
No, and there's not under the Medicare Advantage either. All right, but what happens if you go into the hospital? Let's see, this is it's average amount between $300 and $390. So if you're in the PPO choice, it's $395 copay each day, day 1 to 5, and then it's zero. So if you're on A and B, you haven't picked this up, you're on A and B, you go in the hospital one day, do you remember your deductible? $1,600. If you're on this plan that you pay nothing for, what's your cost for one day? $395. But if you stay longer, what happens?
20%.
It's going to accrue. It's going to get bigger, right? All right, let's see. Skilled nursing, 0 copay a day for day 1 to 20. Does anybody remember what it was on Medicare? Same thing. Same thing. And then after 20 days on Medicare is, I believe, 200. On this, it's 196. And then if you go over, you can see it's the same on each plan. All right? Let's look at if you had a day surgery. Outpatient surgery is like a day surgery. A lot of things are in and out day surgeries now, aren't they? So this one is probably something that could happen if you had some kind of an incident. So you'd pay $395 on the first plan, $350 on that second, $325 over on the $47 plan. All right, so you see how everything's itemized with its own cost. So you do get diabetic monitoring supplies, home health care. You can look at that diagnostic radiology services. This is a little lower than some of the other plans that we'll look at. This is for like your MRI type of a thing, $140. Labs are 0. Outpatient x-rays, $15 across all plans. And then if you see, you know, the ambulance, $195 copay. What happens with the $47 plan? It goes up. Interesting, right? Emergency room, this is pretty common, $90. I think that just about every plan is around $90. And then if you do urgent care, $40, another very common amount across plans. Now let's look at that number. Annual out-of-pocket maximum. All right. So the first plan, $6,700. The second, $5,700. The third, $4,900. Which one do you think's better, higher or lower? Anybody want to take a guess? Do you want a higher out-of-pocket maximum or a lower?
Lower.
Lower. So this number is the most amount of money you're going to have to pay in your copays. So if you start using all these services, and there are more, this is a short list. If you start using these services and your out-of-pocket expenses start to grow, the most that you're going to pay on that first one is $6,700. So you know that's your cap. All right? Worst case scenario for the year. Any questions about that? No? All right. Yes.
On the diabetes one, everything is covered under that?
Yes, but there are some things such as the Freestyle Libre, like the continuous, that would be under Part D. Yeah. So some things it's hard to put it all into one lump. A good question. We could do a whole seminar on that. Yes.
Thank you.
If you had an ambulance ride on the regular, you know, what would that cost you?
I have to look it up. It's not in the database. I should have brought that chart. Yes.
Quick question for you on the outpatient surgery. It has 0 copay and $395 copay, for instance. Why the range?
I don't know what's ever going to be 0. I think it's just a nice number that they like. But I would use the $395 because I think that it's very common. In the last couple of years, it's been adopted that way. It never used to be like that. But I think they like the zeros. All right, so let's see. Let's turn it over. All right. This is the additional or supplemental benefits that can be offered with Advantage plans. These are very attractive benefits, especially if you're 0 premium. What are you going to get? So under that first one, $1,000 of dental benefit. Who wouldn't want that? That's a really great benefit. If you go with that second plan, it's still a 0 premium. It's $1,250. And then your other, the last one is just going to be preventive. Now, the other thing is an over-the-counter credit. So this is something that a lot of the plans offer. They give so much money every quarter, usually, that you can use on over-the-counter items, like your supplements and vitamins and your Tylenol, different things like that. So $50 on the first plan, $100 on that second plan, $100 a quarter. What happens when you're in the $47 plan? You don't get that benefit. And then routine vision and hearing. Now, when I talked about A and B, did I talk about dental, vision, or hearing? They're not part of Medicare A and B, right? If you have an eye health issue that's health related to a condition, that would be covered, but vision strictly is not covered. So under this plan, you have some vision benefits, some hearing benefits, fitness benefits. You can get some meals delivered if you did have a hospital stay. Following that stay, they would help you with some meals being delivered. AARP does something called a house call, so they will come to your house. So these supplemental vary so much between some plans. There's one plan that offers credit monitoring, free credit monitoring. That was the most creative I've seen so far. There's one that offers a box of vegetables every month. There's different ways that they're getting creative. Rewards for staying active. So if you report certain activities to them, you get $10. Sometimes I think it's Tufts that does it. If you go to your primary and you do your preventive type of visits, you get a check in the mail. I think it's $25. So they all have a little different side benefit. Yes, incentives. That's the right word right there. All right. Any questions on this one? Because I have some more we'll go over. You can see how they're laid out. This one's Aetna. So you can see it's similar, right? It's just teeny tiny writing. So I think it helps to look at the other one first. Uh-oh. There you go.
Oh, thank you.
You're welcome.
Oh, yeah.
Oh, sticking together. Did I give you them? Yes. Yeah, you got it. You got one left. I'm going to keep it. Or do I have more? Yeah. I actually have more. Anybody else still need one? Yeah. All right, so very similar. Can you see the similarities? There are 0 premium plans, right? You got it? Yep. So you have the Explorer, you have the Value Plan, and the Eagle. All right. On the top in the purple, I'm cutting out the Aetna Medicare, going right to the different. So that's 3 different options. 0 premium. All right. And again, PCP referrals. This one says there's no referrals needed. So that's a good kind of hybrid, because this does say HMO. Typically with HMO you need referrals. All right, so let's see. It's a national network, and AARP I believe is a national network as well. Let's look at the annual out-of-pocket maximum, $6,700. Does that look familiar? Yeah. Yeah. So that's the most you'd have to pay out of pocket if your copay started to accrue. How much to see a PCP? 0. One plan's 5. Yeah, specialist 45 or 40. So you see the pattern, right? Let's look at emergency room 95. Let's look at that inpatient hospital. So the first one, $335 a day. How many days on that one? 1 to 7.
Yeah, it was 5, no?
Yeah, the one was 5, yep. But then look at the middle one, $495 a day, day 1 to 4. So it gets hard to compare. You can see the challenge on comparing them when things do start to change a little bit, the structure. And then that last one's $345 a day, day 1 to 5. All right. Let's look at this. If you got an outpatient surgery or you had to go to a surgery center, there's different pricing there. $295, $350 for the outpatient hospital services, but then if you go to an ambulatory surgery center, $250. Does anybody have a grasp on that. What's an ambulatory surgery center? It's like another language, right? I'd have to look at that closely to talk about that with you because I don't, it's hard to nail down. Anything for you?
I think it's like eye surgery.
Yeah.
They have a dedicated separate building.
Yeah, maybe something like that. But I hadn't seen that previous years. Maybe I overlooked it. Let's see, labs 0, that's good. X-rays 15 to 20 depending, right, on the plan. Diagnostic radiology is about the same as the other one, 100, 120. Ambulance. This one has an over-the-counter quarterly allowance of $75. It has a dental of $1,000 on those first two, $1,500 on the last plan. Hearing aid allowance, fitness benefit, silver sneakers. This one has resources for living. That's one of the things they talk about, is they have someone that you could call to help you with all different community resources and help get that those referrals for you if you needed some support. All right, let's look at the back. This is going to tell you in general the cost for medications. I don't find that this is extremely helpful, to be quite honest. When I'm looking at your medications, I want to know more. So I use and S.H.I.N.E counselors use the Medicare.gov site to really drill down into your particular meds. But this is a nice like overview each plan has. What about that last one? It's not listed. That last one, the Eagle plan, does not have drugs covered under that plan. Can you get a drug plan separately? No. So if you're in that Eagle plan, you're not going to have coverage for medication. Maybe it's a good thing for somebody who goes to the VA for their medication, something like that. But if you don't have creditable drug coverage, do you know what happens later? When you do get it, you get a penalty. Yeah, so you want to have drug coverage. So if you don't have a coverage under the VA, you certainly don't want to get into that Eagle plan because it's not going to give you the drug coverage. All right? Any questions on that one? All right.
I want to know.
Yes.
Well, it says fitness, silver sneakers. What are those?
Silver sneakers is often at the senior centers. Do you have that here? Some senior centers offer that. No. Some senior centers offer silver in Wise. Yes. It's certain fitness classes.
No, only because I go to
It's
the
a good
Y
question.
6 days a week, so
Have you seen it there?
I never heard of it
Yeah.
before. So now
Yeah.
when I go back,
I'm gonna. Yes.
Some plans.
My brother had it in Florida.
Yes. There are some around here that do participate. Yes. Yep. Yeah. Check on it. Yeah.
Our insurance now, we send in once a year and we get a
Get a reimbursement. That's good. Yeah.
I just want to know what the silver
Yeah.
sneakers
All right, let's see.
Thank you.
You're welcome. All right, so I have some more. I don't know if I have a ton, but I'm going to do the best. We're going to do the best we can. Let's see. This is your Blue Cross. You'll be able to share that one, right? Okay, thank you. Let's see, is this? So this is a whole, you've got to take some time to read this one, right? This is probably going to have the supplemental information in there too.
I'll share because I have.
You will? Okay, thank you.
The ASC, an ambulatory surgery center, is a healthcare facility in which medical procedures, oftentimes surgical in nature, don't require you to stay overnight.
Okay, thank you. It's a lot to take in. I think everybody's got one? All right. You want one to share? Okay. All right, so let's take a look at this one. Do you have anything that you think is missing from any of these itemized lists? Like, do you wonder about physical therapy, chemotherapy, different types of services? Well, a lot of them might be in here. So let's see. Let's look at page 5. This, you can see why I didn't start with this, can't you? It's a lot of information. So do you think you can decide to enroll And a Medicare Advantage, you okay?
Yeah, keep going.
Okay.
So,
Do you think that you could decide on Medicare Advantage based off of a commercial?
no.
What page are you on?
5. You need to study. So my caution is, do not just go by the commercial. Yes, you can get a commercial and get some information to start with, but it's the tip of the iceberg, right? Yes, you could have 0 premium, you could have dental, you could have vision, you could have fitness. Those are all true, right? But what about all the other costs? They just can't tell you that in a few minutes. It's impossible. So here the plans go across. Before they were in the different columns, all right? So if you look at this top one, Blue PPO, Medicare PPO Blue Saver. What does PPO mean?
Preferred.
You're gonna give me the acronym, yeah. You're ahead of me with that one. Preferred provided network, maybe? But what does it mean for you in real life?
Specific doctor.
You can you can go outside of network. Flexibility. When you hear PPO, you know you have some flexibility, all right? Versus HMO, where it's closed network, all right? So let's see. Let me do a scavenger hunt. What is the maximum out-of-pocket on the Medicare PPO Blue Saver? Anybody find it? Yes, right here. See how it says maximum out-of-pocket?
5,600.
And then what's that mean? In-network. If you go to in-network doctors, the most you'll spend out-of-pocket is $5,600. All right? If you go out of network, those expenses, the most you pay is $8,950. Okay? Then if you go down to the next one, so that's the 0 premium. If you go to the next one, it's $75 a month. Do you see that in the red?
Yep.
All right, everybody find it? And then what's your maximum out of pocket? Yes, okay, good. And then if you pay $254 a month, please don't, if you haven't talked to a S.H.I.N.E counselor, do that. Talk to a S.H.I.N.E counselor before you do that. What's your maximum out of pocket in network? $3,400. That sounds good though, right? But that's a lot of money per month. There could be other options. So talk to your S.H.I.N.E counselor before you do that.
It's $3,000 a year.
Yeah. Yeah, $3,400.
Insurance.
Yeah, additionally. So do you end up about $6,700 in the end? Interesting, right? Did you see that, how that works out? If you pay $254 a month and then your maximum out of pocket is $3,400, you're gonna get to $6,000, right? All right. So let's see. So if we go across that first one, let's focus on that first sideways, okay? 0 for your preventive, 0 for your provider of choice, they're calling it, 45 for your specialist, and 30 for a behavioral health visit. We haven't really heard about behavioral health. They are included in the other plans, but they're not listed on the materials. Now, out of network is that second piece. Now, we saw some other plans that were PPOs. Did they have the out of network listed? Would you think to ask that? Until you saw this. This is why we're here. So you think to ask that. What if I go out of network, right? So your specialist goes from 45 to 55 if it's an out of network specialist, and then your behavioral health goes to from 30 to 40. Okay? Still not too bad for a copay, but you have to know what you're getting into. That's the point. Now, if you go to urgent care, these are pretty similar to the other numbers, right, for all the plans. If you have a hospital stay, day 1 to 5 is $390 a day. If it's in network, if it's out, $440. And then you have all your other a lot of your other services anyway. Your labs, your x-rays, $365 for MRI or high-tech radiology. 60 for therapeutic radiological services. I would have questions about what those are, right?
Echocardiogram, maybe?
Maybe. And then you have that outpatient surgery at an outpatient hospital, $325. All right? So there's a lot to look at here. Okay? Now, it does have the different costs for different tiers of medications. Again, the best way to do it is using that Medicare.gov tool to really look at your specific medications. Because even though it says tier 1, maybe you right now you're on a Medicare Part D plan and you know that your 5 meds are tier 1. Well, you could go to a different plan and they could put them on completely different tiers. So you can't always translate that from one plan to another. All right? It could be a tier 3 on this plan. They have the right to change that around.
And they do.
And they do.
And there's in-network and out-of-network pharmacies.
Yes, that's true too. So when we're looking at your drug portion of this, we want to look at what pharmacies are you willing to go to? What do you have in your area? What pharmacy do you prefer? And that's going to change your pricing as well. All right. Let's see what else. So this has a totally different feel than the one pager. Gives you a little bit more information. Let me see if it has the part about vision hearing. Trying to find it. I've looked at it a billion times and I still have to keep looking. Let's see. That one is on your bronze, on your supplement. Let's see. I know that the Blue Cross changed one of their plans, the PPO Blue Saver, from $500 to $1,000 for dental. Let's see. They do offer different standalone dental plans, but the Medicare Advantage plans do have some built in. All right, let's see. And I don't see it on here.
You look at dental,
Yeah, the dental, vision, and hearing.
page 9.
Page 9, thank you. This is the separate dental plans that are offered that you can purchase standalone. But there is some dental built into these Medicare Advantage plans. There's dental, vision, and hearing. I'm just not seeing it. And that's okay. Some of the plans will provide a snapshot of different information, but that would be something you'd want to know before you enroll in this plan. And that's an example. There is so much data under each plan that you really want to, number one, what's the first way we can narrow it down? What's the first thing we should check if you're going to go into a Medicare Advantage plan? Your doctors, yes, your doctors. So number one, your provider network. What plans can you work with? What's the second thing we should check? Prescriptions, very good. Then we go from there and we take a focus on like 2 or 3 of them and really drill down and look at the details and what things you might want to ask. What if at some point you've had to have chemotherapy? You're gonna ask about that, right? Because you probably have experienced that there could be cost. So on most of these plans, not all, but the majority of the Medicare Advantage plans, it's 20% coinsurance for chemotherapy or dialysis, all right? Or Part B medications that have to be infused or injected. All right?
20% you pay or
20% you pay is your responsibility. Yeah. So there are more questions than what is in any of these snapshots. They can only put so much here. On Medicare.gov, we can get a lot more detail and print that out for you and do a comparison. All right. So you can see how complicated it is. Do you have any particular questions, or do you have anything that you thought I might talk about that I did not talk about?
What if you already have a supplement that you're paying for? Like I have United Healthcare, AARP United
Yeah.
Healthcare, and I pay $200 a month.
Yeah.
But I never pay anything else. Everything's covered.
Yeah.
Maybe it isn't, I don't know. but I haven't gotten in, you know, I get a $20 copay for a physician.
Yeah, a lot of people do choose that way. That would be this option. So
Yeah.
there's a lot of people that choose that way, that get their coverage through a supplement plan.
So what is my benefit to going with Advantage?
Yeah, so this on the back, there's some questions about that. So very good segue. It's like I planted you right there. So Medigap, what would be some advantages to keeping Medicare primary and having Medigap? Well, the flexibility. You can go to any doctor, you don't have to think about networks, you can travel with it to other parts of the country. You don't need referrals to see your PCP. You could be in Medicare A and B and pick up this Medigap at any point. It's continuous open enrollment, which I'll talk about that a little bit more in a second. And what happens is you might pay, like this woman in the front row, you might pay a couple $100s a month, and then you don't have costs on the other side when you use it. You're covered. And then let's see. And there's only just a few types of plans. There's 3 standard plans here that you can pick from. So that's one way, and then you have your drug plan. Medicare Advantage, some people really like that convenience about having everything in one card. And what's the premium option people are gonna be drawn to? Zero premium. That's nice. If you don't go to the doctor very often, do you wanna pay $200 or do you wanna pay $0? Zero. You just have to know what happens if that changes. If you do need to have more appointments, if you do need to have more services, it's going to escalate. And what's the cap, the highest cap we saw today? Kind of the average cap on your out-of-pocket? $6,700. So if you're doing well and you want the dental, you think to yourself, I know I have to have some dental done. One of the Tufts plans has $1,500 dental. It's 0 premium. I take vitamins and supplements. I'm gonna get my vitamins and supplements covered with that over-the-counter benefit. Can work out really nicely. But you have to be aware of the costs, right? That's my goal today, is for you to be aware of the costs and the fact that they're itemized out so much that you have to ask questions. You can't just see it on TV or hear a neighbor talk about it. Yes, yes. So be careful. Now, does anybody know when you can change your plan?
By next week?
That's one. So right now, you're smart. That's one of the options. So right now, if you're in a Medicare Advantage plan, you're already enrolled, you have between January and March, the end of March, to switch your plan. You could go to a different Advantage plan. Maybe that plan you're in, your doctor's not going to take it anymore. So you need to find a different one. You have till the end of March to change it. All right, and that's every year you get that option. Everybody on Medicare has annual open enrollment. So every fall you can take stock, see what your expenses were, and you can decide to change it for the next year. That's October 15th to December 7th. Don't wait to get your appointment because it's gonna fill up. It always fills up. So you wanna start calling in September probably to get an appointment, because it's a terrible thing to miss that chance to really look at it. It could take 15 minutes and you could save money. It could take a little bit longer if you dig into Medicare Advantage. Obviously, you have to look at a lot of different factors, but it could be worth a big savings. And you don't want to have a medical emergency and be worried about the costs. That's the last thing you want to figure out in a crisis, right? When you have something going on. So you can change it every year. So if you decided to go with Medicare Advantage, and you could go several years very happy on Medicare Advantage, just check it every year, make sure it's still right for you. If you did have some costs start to escalate, you could switch it over. Or if you are on the Medigap now, and when an open enrollment comes and you say, I haven't even used this, you know, I feel like I'm healthy, I could go to Medicare Advantage. These are preventive type plans, Medicare Advantage, to my way of looking at it. They work better with the cost low, utilizing less of the services, right? Yeah. So, any questions?
Oh, God, a million. Who knows?
Yeah, it's a lot.
I'm gonna meet with Jill. Wherever she is.
Back here, sir.
Yes.
If
You
you're
write
in
me down.
Medicare Advantage and something catastrophic hits you after March, can you change back to
Not technically. You are, after March, you are locked in until open enrollment for the next year. However, S.H.I.N counselors have lots of different things we look for. So we would look for what's called a special enrollment period, or a SEP. So if you are in a plan that's not working for you, whatever plan it is, whether it's your drug plan, a Medicare Advantage plan, and you have an issue, call us because we can check and see if there's some way to change you. We would look for a special enrollment period. We have one that we go to all the time. It's a prescription advantage program that gives you a SEP, and that would help you to switch plans. So that's something you could sort of do mid-year if you qualify. There's different qualifiers. There's other things like if you move. If you move, you have a couple months to get that squared away. You don't have to stay, but you only have a couple months. So, you know, moving is a big ordeal. So if you move, keep that in mind. I've got to change my insurance over. But there are a long list of different special enrollment periods. I can tell you what's not going to count as a special enrollment period. If your doctor doesn't take the plan anymore, it's not going to mean you can change. Or if your drugs change, if you get a new drug, you're not going to be able to pick out another plan. Or if the plan drops or changes the cost of your drug, because the plan can do that in the middle of the year. The plan can change it. They have to give you a notice, but they can change the cost or the tier or something about that drug. It doesn't give you an opportunity to switch, unfortunately. Yeah. Yes.
Well, comment, I've used GoodRx here and
Yeah.
there, where suddenly I got a new medication and it wasn't, the price, I didn't like the price under my plan. So I just asked, is GoodRx cheaper? And it was several times. So.
Yeah, GoodRx and Single Care. There are a few other options or manufacturer programs that people can use. We try to give those types of resources to someone when they are stuck, like if you are stuck in your plan and we can't find an alternative. We do look at that stuff as well. So, any other questions or comments? Anything? Yes.
Okay, so regarding inhalers,
Mm-hmm.
most of them, they don't cover inhalers.
They do certain
You have to do
certain
what they tell
ones.
you to use, not what you
Yeah,
have
so
to prescribe it.
they're supposed to be one out of every kind of class of different types of inhalers. That's covered.
Right.
That's when I
Name
used
one.
GoodRx.
Yeah, but they
Didn't
could
make a
be
difference, huh?
they could be covered.
Right.
So there's a couple different things the way that we talk about this. When it's a covered medication, it doesn't mean you don't have a cost. So it's not covered in full. So it could be that you have a deductible.
$300 is not-
Yeah. So they could say, yes, we cover that medication, ma'am, but it's going to be $500 deductible and then $45 a month. So when we talk about Part D, whether it's the standalone Part D or it's part of the Medicare Advantage plan, it's the same exact structure. All right. You have a formulary. The plans can make their own formularies. There are some rules, of course, that they have to follow, but they can have their own formularies, their own tiers. You could have a deductible on certain tiers. Maybe your tier 1 and 2 have no deductible at all, but your tier 4 might be your more expensive things have a deductible. So you might have to meet a deductible on that. The highest deductible this year is $505. That's a total, not on each med. All right, sometimes I get that question. It's a total amount, and then it will drop down to your regular copay. But if you have a medication that's not even covered on the formulary, you're going to pay full cost. Yeah, which is usually higher than the deductible. Yeah. So not always. You might have some generics that are low, but there's a lot of pieces to the drug plan as well that's built into it. I do want to point out one thing as well about the Medicare Advantage that I didn't say. I usually say in the beginning, is these are companies that have contracted with Medicare to take over your coverage. So these are private companies, and they do have to approve your service. So let's say that you go to the doctor and you're on Medicare and they refer you to a service. They know Medicare. been around a long time, they go through Medicare to get your service covered. If they're going through Medicare Advantage, we've talked about how there are so many plans, right? So they might have to do a little bit more paperwork to get that service covered. So there might be some more red tape in that Medicare Advantage plan. And they could ultimately say, we want you to have this service first or this procedure first. All right, so just to let you know, there could be some red tape there because it's a private company. And the other thing is, when we talked about networks, we talked about like your provider of choice or primary care doctor, your specialist. But we talked a little bit about like an ambulatory service center versus an outpatient hospital type of situation. But I wanted to point out one thing that sometimes can be a stumbling block is skilled nursing. So right now, people going from hospital to skilled nursing are having a hard time finding a spot, right? So if you have a Medicare Advantage plan, you're a network, you also have a layer of you have to find one that accepts your insurance. So it's a little bit different and can be a little bit trickier for skilled nursing because you might think about your providers. You probably will think about your providers that you see regularly or potentially might see a cardiologist, a dermatologist, that kind of a thing. But you don't always think about a skilled nursing facility, right? You don't know where that could be. So it's harder on that side too. So if that's something that you know could happen, if you're somebody who might be facing a surgery or has been in skilled nursing before and you think that's a possibility, it can be tricky with the Medicare Advantage plan. All right? So not to end with like a negative note, but I want you to know the facts. That's the point of it. So anything else? Anything? All right.
Thank you.
You're welcome. You're welcome. And don't forget, we do have S.H.I.N.E counselors at the regional office in Middleborough. We do phone appointments and in person. But we have Jill here who doing S.H.I.N.E. Yeah. If you're at the housing, I think Terry's still at the housing authority, I believe. Yeah, making appointments. So there are resources there that you can have a more in-depth personal conversation about your needs, okay? All right, and if you're new to Medicare, you want to sit down with somebody for sure.